In standard wound care, the treatment itself often creates a secondary problem. When it's time for a dressing change, pulling dry gauze from a healing wound bed can tear delicate tissue and reset the healing process. KytoGraft, manufactured by KytoGraft Private Limited, is an advanced wound dressing made from chitosan. This natural biopolymer is designed to manage complex wounds without adhering to the wound bed. KytoGraft is available in 2 sizes, 5 by 5 centimeters and 10 by 12 centimeters. Before beginning, verify you have the correct size for the wound. Confirm the sterile packaging is unpunctured and that the product was stored in a cool, dry place. Maintaining the integrity of the sterile packaging ensures the dressing performs as intended. Starting with an undamaged product is the first step in protecting new tissue and facilitating a trauma-free dressing change later. To begin the application, prepare the surrounding wound area. Put on fresh, sterile gloves and clean the site using standard sterile saline. This dressing is used for chronic issues like diabetic foot ulcers and pressure sores, as well as acute trauma, including surgical wounds and donor sites. Carefully open the sterile packet and remove the dressing. At this stage, the material will feel dry and fibrous. Place the pad directly over the wound bed. Press it firmly against the areas that are actively bleeding or producing fluid. Secure the pad in place using an appropriate secondary dressing or medical tape. Once secured, the material begins to work. Upon contact, the chitosan deploys its antibacterial properties. This action works to reduce the bacterial load on the wound surface. Because chitosan is a natural biopolymer derived from crustacean shells, it exhibits high biocompatibility. The human body recognizes the material as non-toxic. This natural compatibility prevents local irritation at the application site, allowing cells to focus on tissue regeneration. Securing the pad directly to the wound bed establishes the antimicrobial barrier, which supports the body's natural healing timeline. If the wound is actively bleeding, the material triggers rapid hemostasis. It promotes blood clotting to control minor to moderate bleeding. This diagram shows the dressing's absorbency in action. The fibrous mesh pulls moderate to heavy exudate up and away from the wound surface. As fluid enters the material, the structure expands and permanently locks the moisture within its core fibers. In a clinical setting, you will see this as a physical change. The initially dry, fibrous pad transforms into a clear gel that rests over the injury. This gel state provides a controlled, moist environment, which is optimal for cellular repair. The dressing utilizes the patient's own exudate to engineer this protective healing environment. When the patient is ready for a dressing change, the removal process follows a specific protocol. At this stage, the primary clinical concern is adhesion. If a dressing sticks to the wound bed, removal can tear the skin and cause fresh bleeding. Because the chitosan material has maintained its cohesive gel state, it does not adhere to the healing tissue. To remove it, gently lift the dressing from a single corner. As seen in this close-up, you can then peel the gel layer back in a slow, continuous motion for a smooth release. Underneath the gel, the delicate new granulation tissue, the vulnerable first layer of new skin, remains undisturbed. This frictionless removal ensures a trauma-free experience for the patient. By removing the risk of secondary trauma, KytoGraft protects the progress of the wound. The tissue remains healthy, and the timeline for regeneration continues without interruption.